Welcome to all our viewers. I'm Commissioner Tye Menser, Chair of the Thurston County Board of Health, and I'm here virtually with Dr. Dimyana Abdelmalek, or Dr. A for short. She's our new Thurston County Health Officer, and her experience is a great asset as our community continues to navigate through the COVID-19 pandemic. But I hope we can focus on some other topics during our conversation today. Thanks for joining me, Dr. A.
Thank you, Commissioner Menser. It's always a pleasure.
I know it's probably difficult right now with COVID-19, but have you had any opportunity to explore the county? And if so, what places or things have caught your attention about it?
So I've really loved exploring Thurston County. I go for urban walks in downtown. I've been to the farmer's market. I love Capitol Lake. I've also been taking solo road trips. So I've explored Tumwater, Lacey, Yelm, and Rainier, Tenino, and Rochester are next on my list. So those are coming soon. And I look forward to seeing all of our different communities.
Excellent. I personally have a 14-year-old that's getting into mountain biking. So I've been learning about some of the mountain biking opportunities Thurston County has during these last few months. It's my understanding you have experience working on health issues around the world. Tell us about your background and experiences, and share with us specifically about your international work.
So I have a passion for engaging with communities around the world on complex health issues. During my junior year abroad in Cairo, I ended up working with a local community on schistosomiasis, which is a parasite that you contract from contacting the Nile and Nile water. I learned about the importance of public health messaging and community involvement. As a medical student, I ended up working in Ethiopia, where I started out working with non-governmental organizations, the Ministry of Health, a maternal child health center, as well as on nutritional projects and vaccine projects. As I got more and more experience, I returned to Ethiopia and I created simulation models to teach my Ethiopian counterparts procedures, as well as an approach to trauma and mass casualty incidents. As a fellow in global emergency medicine, I worked with International Medical Corps as a volunteer medical advisor for the Middle East region, which included Jordan, Lebanon, Turkey, Iraq, and Syria. As a volunteer medical advisor, I created minimum guidelines for refugee clinical programming, and then I performed a gap analysis, either visiting clinics or interviewing those who manage the clinics about whether or not they were able to meet the guidelines and what challenges they faced.
Wow. And now here you are in Thurston County, Washington. What attracted you to Thurston County, both as a location to live and a place to work?
So I love the outdoors and I have long loved the Puget Sound. I've got family on Vashon, family in Portland. I have friends, here in Olympia, as well as friends in Seattle and Portland. So this was a great fit for me. Also meeting you, our Board of Health, Shelley, our Public Health and Social Services colleagues during the interview process made me realize how special and unique our public health system is here. And I felt that I would be a good fit and that I could really contribute.
Um, so I want to ask you about the change in your career. You've just now moved from a position more actively practicing medicine, and I think it was Redwood City, California, to a more policy-oriented position here as our Thurston County Health Officer. What led you to make that decision, that change?
So when I was working as an emergency physician, I noticed that on my days off, I was showing up to conferences put on by my local public health department, and I was showing up to conferences that were led by our local schools of public health. And so I felt that with my background, with a master's in public health and my background, working with communities around the world, that working on health at the community level would be a great fit for me. I do love taking care of patients, and I do hope that at some point I can reincorporate some of that into my practice as well.
Good. Now, what long-term issues or priorities are you most excited about and working on here for Thurston County residents, aside from navigating us through the COVID-19 pandemic?
One of the best things about working with Thurston County Public Health and Social Services Department is that I'm surrounded by experts who in a number of different specialties, and I'm always really excited to be the medical consultant on whatever projects our teams are working on. I have had the opportunity to be a part of the opioid task force. I've had the opportunity to work with our emergency preparedness colleagues, and I'm excited about working on maternal and child health as well as vaccine preventable illnesses. Getting to work with so many great colleagues, I'm always happy to be the medical consultant that kind of helps move our teams forward as well.
Now, of course, we have to ask you about COVID-19. And on that topic, what is the key information that you'd like to convey to the public?
So I really want to thank our community for all of their efforts to wear a mask when they're in public spaces, maintain at least 6 feet of distance between themselves and members and people who are not members of their households, as well as limiting gatherings, covering their cough, and washing their hands. The more we follow these guidelines, the more we're going to lower our transmission rates and allow for a safe return to public life.
What is your advice for people who are feeling anxious or worried about the COVID-19 pandemic? And how can they balance the need to slow the spread of the disease with other important activities for health, such as connecting with loved ones or staying physically active?
So that's a real challenge. Physical distancing doesn't have to be social distancing, and if you're in distress, there is help. We do have a number of resources on the Thurston County Public Health and Social Services website that you can connect to. For me personally, I've been using video chat, email, phone calls to stay in touch with loved ones near and far. And when I see my loved ones in person, I make sure not to see more than 10 people outside of my household per week. But I meet my loved ones outside. I stay at least 6 feet away from them, and I'm always wearing a mask. I know that if we all kind of take these precautions while staying connected, we're going to emerge from this pandemic a much stronger community and better able to meet future challenges.
I'd like to thank Dr. A for joining me today and for this good short conversation and introduction to get to know her a little better. Thank you for being here, and I'll see you at the next board meeting, which I think is tomorrow.
Thank you, Commissioner. It was a pleasure.
Thank you. If you see Dr. A at the grocery store, say hello. Or if you read one of her weekly letters to the community and find it helpful, let her know with an email or message on social media. Thurston County is fortunate to have Dr. A on our team, and I feel confident we will make it through the COVID-19 pandemic together and continue making progress on other health crises affecting our community. Until next time, stay safe, stay healthy, wear a mask, and wash your hands often. Thank you.